All right, let's get into our first topic then. And should we give billions more to the NHS? Hospital chiefs are calling for an emergency injection of £3 billion to cover unexpected costs. They're struggling with the impact of strikes, redundancies and rise in medicine prices. Without more money, patients might have to wait longer for treatments and hospitals could even start rationing care. But it is a big ask for Rachel Reeves, who is already trying to fill a £30 billion black hole in next month's budget. So, Alys, can we afford to dish out this cash to the NHS?
I don't think we can. I think we've seen that the NHS is just a bottomless money pit. Rachel Reeves already gave it something like 29 billion extra in real terms over the course of this Parliament, but nothing seems good enough for the NHS. It keeps coming back for more and more and more. And I think what's particularly frustrating about this ask is that a lot of the extra costs they're saying were incurred by the strikes. This was after doctors were already given an enormous pay rise and went on strike nonetheless for extra money. I think it just proves that there's no amount of money that will ever satisfy the NHS. I think, as we say, Rachel Reeves has got her budget. She's got this huge black hole to fill. She needs to be looking for productivity gains, not just more money. We need to be making the service more efficient, and we need to be getting more for our money.
What do you think, Michael? Is it throwing good money after bad?
No, I really object to the idea that it's a bottomless pit, because this money is being spent on doctors and nurses and equipment. And we don't actually spend that much on the NHS compared to other countries. So at the moment, much of Europe, France, Germany, they spend 12% of GDP. We spend 11% of GDP. So the idea that we're spending above the odds for the NHS is just untrue. We have an ageing population. We are going to continually have to spend more and more on the NHS. I think the issue is that we need politicians to be honest about that and say we are going to have to keep spending more and more every year on the NHS. That's just the reality, which means we are going to have to increase taxes.
But I think that's the reality of the socialist model we have of the NHS. You mentioned France, it's got a social insurance model. There are other models of funding that we could have, which involves more private sector funding, more of people paying their own money for appointments and so on. And these systems across the world get better outcomes than the NHS. You're right that we don't spend so much money per head, but we have considerably worse outcomes than many other comparable systems. I think we do need to get rid of this socialist model, because ultimately, when you have a sort of set a supply that is determined by the state, the only way you can handle demand is through rationing.
And maybe we do need to pay a little bit more, or those that can afford, because we're putting more and more pressure on the NHS. We're ageing as a population. We're getting bigger as a population. This is essentially going to be a bill that just gets exponentially bigger. And then if you want to add on to that, investing in future in initiatives in better equipment and better medicines, then that number's going to have to be a lot higher than we're paying at the moment.
Yeah, the bill is going to keep going up. That's just the nature of having an ageing population and having better technologies. We're all living better. This is a good news story, right? We shouldn't just feel down about it. The fact that people are living longer, that's great. You're right, there are lots of models that seem to work. So the French model, the Australian model is fine. It is worth pointing out, though, that the people who spend the highest amount on healthcare in the world are the Americans, and they have the worst outcomes, and that's because they've completely privatised their healthcare system.
I don't think anybody would argue we should have a US-style system, but I think you're increasingly seeing people voting with your feet. The number of people who pay privately for GP appointments and so on because they just can't get one on the NHS is going up.
We're talking about people going abroad as well now. If we're not taking care of our NHS to the point where people are then going abroad, it's costing us more, actually. So if you think about it in those terms, can we afford not to invest that $3 billion that's being requested?
No, I think what this shows is that people are actually prepared to pay for their own healthcare, that we don't actually have to cleave to this post-war socialist model of the NHS. I think that the idea that we have this kind of political idea that it's, what is it called, the national religion? I think we need to get away from that. We need to be much more honest about the fact that the NHS actually gets much worse outcomes than other comparable health systems. It's not this kind of best of British thing. It's just a public service like any other, and it should be improved.
OK, let's go to the calls. Nancy from London, what's your thoughts?
Hello.
Hi.
Hi. My thoughts about this is that we have the best service anyone can have in the world, in spite of all the complaints and all the things that people are saying. I would rather pay more from my tax so that we can have this service. There are so many countries whereby you cannot even get healthcare if you do not have so much money. So I think we should invest more in our NHS service by us paying more into it.
Alys, what would you say to the statement that Nancy made that we have the best care anywhere?
I'm afraid it's just not true, Nancy. Our cancer survival rates are much lower than comparable OECD countries. It's just not true that we have the best service anywhere in the world. And there are many People should be demanding more of the NHS. I don't think this idea that it's so wonderful actually survives any contact you might have with it. You look at the massive scandals we have in maternity services, for example, 1 in 5 maternity services not safe for women giving birth. Those aren't women who are ill. Those are just women going through a natural human process. It's not good enough and it needs to be better. And I think this kind of shibboleth that we have in our politics about it stands in the way of really holding it to account as we should be doing.
And we're talking about the NHS in England here, but actually similar things are happening all over. In Scotland, they've had an injection of money recently into the NHS. And although things have improved slightly, we're still not back to pre-pandemic levels. So I suppose the question is, Nancy, how much money are you willing to put into the NHS to try and get it into a position that maybe even you remember as a child?
Well, I would say probably another 10%. I really disagree. My personal experience, I had a first child and I had problems. But from then onwards, I remember being very ill at the point of death. And I know how the ambulance people came and took me into hospital. If I hadn't been able to get into hospital, I would have lost my life. I know that the service could have been quicker. But having said that, I could have lost my life about 3 years ago. And I've been in situations that have been very difficult. And I can't fault the care. I still believe that the NHS is still a service that should be admired, and we should all pay more into it if we can, so that we can sustain this service. Rather than being something like America, if you don't have insurance, you can't get care. Or some African countries, you can't even get to the hospital due to various circumstances. I will still support the NHS. I will pay more from my wages to make sure this service is sustained, because I've been treated well on it, and
Nancy,
my family has.
I have to say, it's really nice to hear a positive story about the NHS, because a lot of the time when we do these discussions, the people that call in, that feel compelled to call in, are people that have had very, very bad experiences with them, have been left waiting, had misdiagnoses, all sorts of things. So it's great to hear that you have had a fantastic... I also have had great treatment on the NHS, and I think when you have, and if you've been at the brink of life and death, I think you probably would be quite evangelical about it. You would think this is the one thing that we have to save more than anything else. Nancy, thank you for your call.
I was going to say, I think what's also just very admirable about what Nancy said is she was willing to put her money where her mouth is. She says, I value the NHS. I know that's going to cost a lot more money. That means I'm willing to pay more of my income towards the NHS. I would agree with that. And I think actually lots of the public would. I think Labour made a big mistake when they said, we're not going to raise any of the big taxes. Gordon Brown in the early 2000s stood up at the budget, said, I'm going to put a penny on national insurance and it's going to go to the NHS, most popular budget in decades.
Well, I think the problem is the trust and whether we believe that that money will be ring-fenced. A lot of the time when we do these conversations, that is the question that comes up. Clive from London, do you think that Rachel Reeves should find $3 billion for the NHS?
It's a difficult one, I think, because I'm really thankful for the NHS. I've got like a long-term health condition. But I think there's so much waste in the NHS. So to give you two examples, my mother used to have problems walking, and when she died, we said, we called them up and we said, do you want to come and get the walking frames? Do you want to take them back? Yeah. When do you want to come and do it? And they said, no, just throw them away. And another example, I went and picked up a prescription, and they said, gave me the wrong tablets. And I went back to the chemist and got the correct tablets, and I handed back the existing tablets that the service had done wrong, and they said to me, no, we can't send them back, just throw them away. And I think, we should give them more money, but I think until they sort these problems and this waste of money, it's just like giving money to a big black hole.
Yeah, I mean, the crutch example, I've had in my own family as well, where somebody tried to give it back and they said no, and it blows my mind. I don't understand why they can't find some sort of process of cleaning them, why you just get rid of them. I can't work that one out. A lot of people talk about waste, not just the practical waste there, as Clive brought up, medicines and walking sticks and that sort of thing. Also, a lot of people complain about middle management. And
well, a lot of people complain about middle management. I think we have had a problem in this country where governments go after, they say, oh, we should give money to doctors and nurses, but all the people in the back room, let's cut that to the bone. And actually, there's lots of analysis that says that's actually where we're not putting enough money, because you do really need to have middle management to organise when the operation is, who needs to be there. Because at the moment, speaking to people in the NHS, you hear lots about doctors being sent to the wrong place, nurses being told to come in on this day, but then the operation
Which is a
getting
real
cancelled.
waste.
And so I think there's a kind of populist attack, I think, on middle managers that isn't necessarily the best thing for the NHS. I suppose when it comes to, crutches and the like, that's partly because presumably they import them very cheaply from China, and you have to pay people quite a lot to go and pick them up and wash them in the UK.
So it would be more expensive
Probably more
to wash
it's
them
probably
than buy
cheap.
them new?
I think the NHS, if it were cheaper to get those crutches back, they would do it. I think there's an environmental question. Maybe they should do it, but I think they're probably making a decision that that's the cheapest thing to do.
Well, that is surprising. Clive, thank you very much for your call and bringing that to our attention. Alfonso from Birmingham, do you think we should find $3 billion for the NHS?
Well, not really, though. Instead of funneling ever-increasing budgets into the NHS, we should look at spending money towards community health centres and well-run nursing homes, because this puts a lot of stress on the NHS, and we tend to use the NHS for virtually everything. It's like a capture-all syndrome, rather than having more specialised services that can prevent prevent illnesses in the first place, or have cheaper alternatives by funding nursing homes rather than the health centre.
Yeah, and actually there's studies done that when you use preventative care, you do save money in the long run. So maybe not throwing it into the NHS, but throwing it into other schemes. Would you support that, Alys?
Yeah, I think your viewers have absolutely nailed this problem. I think Clive's absolutely right that the public it's a huge priority for the public. They want to see money spent on it, but they want to see it spent well. And I think Alfonso's put his finger on the real problem that we have, which is social care, which is not funded in the same way out of central government funding. It's funded by local authorities, and that is where the huge pressure comes on the NHS. It is with people needing lifelong care, and that's where we need a long-term sustainable settlement for social care, and probably that is going to have to involve some people paying for their own care.
It's not often that I get good news in my ear while I'm doing a show, but I've just been given some. Apparently the NHS has started a reuse scheme for crutches, so if you do have, it's relatively new, if you do have one, don't listen to what we've been saying. Go to the NHS and ask where you can give it back so they can clean it for somebody else to use.
Just a waste of money. Throw them away.
Recycle them. Yeah, don't listen to Michael. do try and give them back. I don't know whether the hospital near you will be running the scheme, but try. Alfonso, thank you very much for your call. Anne from Devon, what's your thoughts on this?
Well, I've been in hospital for 2 weeks. Now, can I ask that woman on today,
Alys. Yes.
Alys, how many hours a day does she work? Because the nurses and doctors do 12-hour shifts. How many other people do 12-hour shifts? They were absolutely fantastic.
Okay, Alys, I think, and your criticism is that you were talking about the money going to doctors that were striking, nurses that were striking. Do you defend that? Do you think they're worth the money? Would you pay them more, pay them less?
I think they had a very generous, the doctors in particular, nurses not so much, and it's great to hear that you've had good care in hospital. That's not everybody's experience at all. No, I think they've had very generous pay rises. They have much more generous pensions than many people in the private sector, many of whom work far longer days than 12 hours. Look, of course, people get amazing care in the NHS, but if you look at comparable countries with different funding models, they get better outcomes, and that's really what matters at the end of the day. What matters to you if you're ill is knowing that you're going to have good care and that you're going to get better, and the NHS has bad results when it comes to that.
Okay, and do you accept that premise that actually, regardless of how much the nurses are getting paid, we're getting bad results, so we need to do something about it?
Well, yeah, I think they deserve everything they get. I had excellent care, absolutely excellent care, and like I say, I'm home now. But I was very, very ill. And they were brilliant.
And that's fantastic. It sounds like the NHS done exactly what it was supposed to do for you, and I wish you the world of health from now on. Thank you so much for your call. Sonia from Edinburgh, what's your thoughts on this? This isn't $3 billion to the NHS in Scotland, crucially. This will be just for England, but what's your view?
Still, there is no difference for me from England from Scotland. I'm prepared. I've got good income. I'm a taxpayer and I'm retired. I'm 72 in 2 days, and I don't mind paying more to keep the NHS going. We have the best service here. I disagree with lots of people say they didn't have enough experience. What percentage they talking about? How many people against that person didn't have good experience? I think it's just maybe 1% have no good experience.
Oh, well,
maybe
no, we've
less.
got, Sonia, we've got millions of people on waiting lists, and I think those people might have very different stories to tell and experiences of the NHS. But I appreciate if you've had good care there, you do really appreciate it.
Yes,
and also,
I'd
just like to wish you a happy birthday for 2 days' time. You really skipped over that. Sonia, thank you very much for your call. We are going to have to move on now.